Regular dental exams aren't just good for your teeth. Dentists are also able to spot and diagnose other health issues and diseases sometimes before you even notice symptoms.
Yeah, sure are. Joining us now with a look at some of the conditions your dentist might find is cosmetic dentist Dr. Daniel Rubenstein. Thanks for being with us this afternoon.
Thank you so much for having me, guys, again. I really appreciate it.
Well, let's talk about it. How are dentists able to spot and diagnose unrelated health issues during an exam?
That's a great question. Dentists are really the specialists of the head and neck. The mouth is the gateway to the rest of the body. So a lot of the diseases that start in the mouth could be spread throughout the whole body. Could be diabetes, heart disease. It could be something dealing with acid reflux. So we really get to detect and then refer out if we see some abnormalities.
All right, let's get even further into some of these diseases you can detect. First one up, obviously oral cancer, but there are tests for this, but how can you actually tell?
So if you go often enough to the dentist, your dentist or hygienist should be checking not only your teeth, but your tongue, the back of the throat, the lymph nodes on your neck and face. And if we see any abnormalities on the sides of your tongue, white lesions, red lesions, we're gonna put it like a red flag on that and then refer you to get it properly detected and diagnosed.
Yeah, it's really interesting how much you can discover. Heart disease is something else that's on the list. How does a dentist spot that during a checkup?
So we can't spot heart disease, but there's a lot of correlation between gum disease and heart disease. The plaque in your mouth is actually similar plaque to your heart. So anytime we see an aggressive amount of periodontal disease, we want our patients to get the blood work. We want to see what's going on with your heart, because it's not just about your mouth. Your head is connected to the rest of the body. We want to make sure that you're healthy all around.
All right, so dentists can also diagnose diabetes. So what are some clues that a dental patient is actually suffering from that?
Sure. I mean, diabetes relates a lot in the mouth. Your gums can bleed very easily, swollen gums. You start to get bone loss, which causes your teeth to come loose. You start to get dry mouth. So if we see those red flags, what we're going to do is ask you again, go to the medical doctor, get your blood work, see what's going on. If you do have diabetes, is it under control? Is it not under control? So all those questions have to play a big role in your dental health.
So if a patient is suffering from stomach problems, how can you tell when they have acid reflux, or is it something else?
Yeah, so I mean, I know that I'm guilty of this. Sometimes if I overeat or I eat too late, I can get that acid reflux. The acid in your stomach is so strong, and people that have a chronic condition of acid reflux and it goes through their throat into their mouth, that could burn away and erode your enamel. Your enamel will become thinner. We can see how thin your enamel is getting. It's becoming grayer and very sensitive at that.
Okay, so the next one is something that impacts 9% of the population. We're talking about eating disorders. So what are some things that a dentist will see in someone suffering from this?
So that's very interesting, because a lot of people might not want to disclose that information to their dentist. And also, people with eating disorders that have something like bulimia, where they throw up, the front of their teeth look fairly normal. It's really the back of the teeth that look really eroded. It turns super yellow because the enamel gets eroded away. So if your dentist is really checking everywhere, it could put like a red flag on that part of your mouth.
So how common is it for dentists to spot an unrelated health issue with a patient, and what do they actually say or do about it?
The goal is for you guys to continuously go to your dentist, not just for us to just take a look and leave, but to make sure and be proactive about your health. So when we're not looking to find problems. We're looking to make sure that everything's prevented. And if there's something that's abnormal, even something small, it can help save your life. So the idea is to be consistently going to the dentist so that we could really keep an eye on everything.
I feel like when we have you on, we need to call this the smile segment, because I feel like we even smile even more. But tell us, has there ever been a situation where you actually diagnosed someone with an unrelated health issue from their mouth?
Yes, it happened a handful of times, because I'd rather it be safe than sorry. So if I see something, and especially if I've been seeing these patients often enough, and I see something that hasn't been there for a while, and I don't know what exactly it is, I can refer that patient out to my pathologist, oral surgeon, and let them do the biopsy. And unfortunately, if oral cancer is not caught early enough, it can be deadly. So the idea is to catch things as early as possible, refer out, and make sure you stay healthy and happy for as long as possible.
All right.
Dr. Rubenstein, thanks so much for being with us this afternoon, for talking about that and letting people know what is going on in their mouths. We'll see you soon.
Thank you guys for having me. I appreciate you so much.
Sure. Take care.
Good weekend. Bye.